How do you get health insurance as a traveling therapist? That's a great question. It's something that comes up all the time, so I'm happy you're here. And hi, my name's Julia. I've been a traveling speech-language pathologist since 2010. I've mentored thousands of other traveling therapists over the years, and I'm happy to bring you all the information I have from my years as being a traveling therapist to you. So let's talk about health insurance. And make sure you subscribe to my channel and check out all my links because there's a ton of information there. But back to health insurance. When you're a traveling therapist, on the time that you're actually on contract, you can get health insurance from the agency you're working for. And often that health insurance can extend in between contracts, sometimes 2 weeks, sometimes a month in between contract. So if you're consistently working for a single agency, you might want to get health insurance through the agency you're working for. However, not everybody consistently works for one agency, and you might not want to hop insurance so much. You might want to stay on one plan. Then you might want to consider getting your own private insurance plan. You can buy your own private insurance plan. There's open enrollment every year, or if you lose insurance, that would be a qualifying event to buy a new plan, and you could buy your own plan. I personally buy my plan through the government marketplace, healthcare.gov, lower. So I get my health insurance through healthcare.gov, but for years and years and years, I actually got it through my agency. And now you might be wondering, well, what if you get your health insurance through your agency, but you got a big gap in time? I got you on that. It's so simple. It's called COBRA. COBRA has a long name. It stands for the Consolidated Omnibudget Reconciliation Act. Okay, we call it COBRA. But basically, it means that if you lost insurance for any reason from your employer, you can actually buy that same insurance out of pocket for up to 18 months. So if you lose insurance through your agency and you don't want to get on your own private plan, you can sign up for COBRA. And the cool thing about COBRA is it's retroactive 60 days. What that means is that if you lost your health insurance, maybe took 6 weeks off of work, then got another job where you got health insurance, and you actually never needed to use your health insurance during that time, you actually don't have to sign up for COBRA. You could just go without insurance. And nationally, you don't get any marks on your taxes or anything if you go without health insurance. Some states might still have that, so you would want to look into your state. But on the reverse, if you go 6 weeks without health insurance and then you need your health insurance for any reason, COBRA is retroactive, so you could sign up for COBRA as long as it's in that 60-day window, and you would have health insurance from the time that your job was terminated. So basically, you would never have gone without health insurance. It would just carry over as though it was always there. So you can go and do that. Like if you need COBRA, you can sign up. If you didn't need it, you could skip it for maybe a certain amount of time. You can also cancel your COBRA plan at any time. So if you end up getting back on your agency insurance and you're on COBRA, you can cancel. So that's how to get health insurance as a traveler, kind of in a nutshell. Do you have any questions or comments? Let me know.